Gastroesophageal reflux disease. Gastroesophageal reflux disease. A digestive disorder that affects the lower esophageal sphincter, less, causing what is in the stomach backs up into the esophagus. In normal digestion, the less opens to allow food into the stomach, then it closes to stop food in acidic stomach juices from flowing back into the esophagus. In this pathological condition, the less lets the stomach's contents flow up into the esophagus. Symptoms: heartburn, chest pain, nausea, vomiting over and over again, bad breath, shortness of breath from swollen airways, dysphagia, trouble swallowing, dry cough, globus pharyngeus, choking sensation, feeling like having a lump in the throat. It can also cause hoarseness, especially just after getting up. Tooth erosion. Acids wear away the enamel on teeth. Risk factors and causes: children under the age of 2 years. Gastroesophageal reflux, GERD, often occurs in infants under the age of 4 months, but normally disappears by the age of 12 months. If it persists in the long term, GERD, it can affect weight gain, development, and quality of life. Hiatal hernia may weaken the less, caused by coughing, vomiting, straining, or sudden physical exertion that can raise pressure in the abdomen. Healthy people ages 50 and over also tend to have a small one. Obese, overweight, pregnancy, gastroparesis, delayed emptying of the stomach. Diseases of connective tissue, e.g. rheumatoid arthritis, scleroderma, lupus. Diagnosis: endoscopy. It can find esophagitis and also carry out a biopsy for more testing. Upper GI series, special X-ray for esophagus, stomach, and duodenum. It can rule out peptic ulcers. pH impedance test, esophageal pH monitoring, inserts a thin, flexible catheter with an acid-sensitive tip through the nose into the esophagus, placing the tip in separate recording spots to evaluate the flow of liquid from the stomach into the esophagus. It measures the acid levels inside the esophagus and the movement of liquid and air up and down the esophagus. Esophageal manometry measures the contractions, force, and coordination of esophageal muscles as they move food to the stomach. Differential diagnosis: heart disease, heart attack. Exercise may make the pain worse, and rest may relieve it. Heartburn. The pain is less likely to go along with physical activity. Complications: esophageal ulcer. Stomach acid makes open sores. Esophageal stricture. Stomach acid damages the lower part of esophagus and causes scar tissue that builds up until it narrows the inside. Barrett's esophagus. Acid reflux damages the epithelium of the esophagus, making it thicker and changing it from pink to red. This can lead to esophageal cancer. Lung problems. The reflux can get into the lungs, aspiration, making voice hoarse. It can also cause postnasal drip, chest congestion, and a lingering cough. If the lungs get inflamed, it can lead to asthma, bronchitis, and pneumonia. Treatment. Diet. Avoid chocolate, peppermint, fatty or fried foods, and coffee. Avoid citrus, fruits and juices, tomato products, and pepper. Avoid large meals. Eat slowly. Chew food thoroughly. Lifestyle. Avoid smoking, alcohol. Avoid eating too soon before bed. Stand upright, wear loose clothes. Drugs to avoid. NSAIDs, e.g. aspirin, ibuprofen, naproxen. Drugs to take. Analgesic and antipyretic. Treat fever and mild to moderate pain, e.g. paracetamol, acetaminophen. Antacid. neutralizes acid in the esophagus and stomach and stop heartburn. E.g. alginic acid, bismuth subsalicylate, aluminium hydroxide, magnesium carbonate, calcium carbonate. But long-term use can cause diarrhea, altered calcium metabolism, buildup of magnesium in the body, bad on a kidney disease. Recommended to use 2 weeks maximum. H2 blocker reduces acid in the stomach for chronic symptoms, e.g. cimetidine, famotidine, nizatidine. Proton pump inhibitor blocks a protein needed to make stomach acid, e.g. omeprazole, pantoprazole, lansoprazole, esomeprazole. Rabeprazole, prokinetic, helps the stomach empty faster, not to have as much acid left behind. E.g. metoclopramide, domperidone. Surgery, usually performed when medical therapy has failed. Fundoplication. The fundus of the stomach is folded and sewn around the lower esophageal sphincter. The hiatus of the diaphragm may also be tightened. It raises the pressure in the lower esophagus to stop reflux. It can be done either through a laparoscope or open surgery. Nissen fundoplication wraps the fundus the entire 360 degrees around the esophagus. Transoral incisionless fundoplication wraps the stomach around the less with plastic fasteners. It can be done through an endoscope. Lynx surgery wraps a band of magnetic titanium beads around the lower end of the esophagus. The magnetic attraction of the beads keeps it loose enough to let food pass through into the stomach, but tight enough to stop reflux. Stretta procedure puts a small tube down the esophagus that uses low radio frequency heat to reshape the less